Whenever we speak about tobacco, we think of a cigarette. And when we think of a cigarette, we think of the smoke. And that is where the concern comes in. But snuff is actually the tobacco leaves that is grounded, and then it's actually just used just as it is. So it is smokeless, and the active ingredient in that is actually nicotine. So when we speak of smokeless tobacco, or when we talk about any tobacco product, including cigarettes, including snuff, including any other thing that includes that, like shisha, all of this have an ingredient called nicotine. Now, nicotine is a substance that is a stimulant. Now, what do we mean by stimulant? It activates your physical body as well as your mental side, okay? So that is what snuff is in general. The psychoactive stimulant, it's a substance that acts on the mind as well as the brain as well as the physical body.
Coming to the traditional aspect and the way it is traditionally used is that firstly, for older persons, it keeps, I believe, from my own information gathered from older people, including my grandfather and my grandmother, is that when they use it, they feel warm. So it keeps the body warm. It was used as a medicine for young children if they have a certain condition, and one of the conditions is flu or a cold or a cough, and they would use it. Unfortunately, it has its own negative impact. It can cause corrosion if it is applied straight onto the body, and where I hear that some women are using it into their vaginas, which is a dangerous thing to do.
When we talk about the mental effects, when we talk about the mind, it has physiological as well as emotional problems that it comes with respect to nicotine. So nicotine is one of the most addictive psychoactive substances, arguably one of the most addictive substances, and very hard to get over once you're actually used to it and when you become habituated to it. Youth demographic, which is from the ages of 15 going all the way up to 35, yes, there are more people that are more open to discuss this and say, yes, we do this, we do take snuff, or we do openly, take shisha. So these are other substances that people are more open to talk about them because, like right now, the youth are more open to discuss these things.
It was used in a medical perspective. Today, it is being misused. And I've talked to some women who have said, yeah, they use it to keep their bodies warm, for purposes of sexual gratification, which is, I think, quite an abusive way of using the product or the substance, and is quite unhealthy.
With the older generation, which is grandma and everyone else, because it's part of the tradition and the culture growing up, they have been taking it, but right now even the youth are actually experimenting with it more and more. The level and the severity of habituation, as well as reaching to addiction, which is a brain disorder, on that one we need to just see how it pans out.
A warning to the young women who use it for the purposes of inserting in the private parts, that is very dangerous, and this is a very strong substance. It's a very strong substance. It can cause you a lot of damage in not a long time, in a short time.
Snuff is something that we are actually advocating for because it has a lot of physical complications that comes with it. As you've mentioned, there are certain cancers that do come with snuff. Nasal cancers, oral cancers, tooth decay, mouth problems. We're also seeing a lot of habituation, a lot of people are getting used to it. We also see pregnant women actually taking snuff and having challenges. But all these things, we don't know the stats, and as you've rightfully put it, as associations and as bodies, we are actually going in that direction to bring our own narrative and our own statistics, yes.